Thank you for viewing our C427 Topic 4 cohort session, Security of Health Information. In today's session, we are going to discuss the Healthcare Management Information Systems standards. In both topics 1 and 2, I made reference to the standards in healthcare information systems and how these standards establish many of the processes and rules and regulations as far as being able to access and exchange healthcare information. So today we are going to focus on these standards in the adoption of healthcare information technology. We will be discussing the HMIS standards, HIPAA, HL7, DICOM, and the web standards. Before we jump into any specific standards, let's chat about what are standards in healthcare. Standards ultimately lead to a higher quality of healthcare services for both the individuals, the organizations, as well as the population at large. They do have the great ability to improve healthcare service as well as those healthcare service efficiencies, reduce costs, and facilitate interoperability. Remember, we discussed how there are so many barriers as far as well, not so many, but major barriers as far as the interoperability is concerned, but the purpose of many of the healthcare standards being established was to mitigate some of the challenges that we found with the early EHR implementation. Who benefits from these standards? Well, we've said the individuals, consumers, the patients, the independent healthcare providers, university affiliated teaching hospitals, major corporations such as those in the medical device service, as well as the pharmaceutical industry sector, governments and funding agencies, as well as the insurance companies, HMOs, non-government organizations, and the nonprofit healthcare organizations as well. A few of the emerging standards in healthcare information technology, or they have already emerged, the logical observation identifiers, names, and codes, the LOINC codes, you may hear them being referred to. SNOMED, the Medical Information Bus, the American Society for Testing Materials, the Healthcare Informatics Standards Boards. These are many of the industries and standards leading the industry in developing and establishing standards, meaning what the rules, those regulations, those processes on accessing information and exchanging information. HIPAA, Health Insurance Portability and Accountability Act. HIPAA is the protection piece, right? HIPAA is aimed at improving the privacy, confidentiality, integrity, and security aspects of PHI. You may see that as PHI, or personal health information, or protected health information, and to simplify the movement of individual patients' protected health information between healthcare professionals and other covered entities that require the information, such as insurance companies, right? They need your information for billing purposes, or it could be shared between other healthcare entities. HIPAA is what ensures that that information is protected. Okay. Data coding standards. These are standards that are aimed at defining common medical terms and specifying how medical data should be recorded within the records, right? So the key terminology, that vocabulary standards for classifying and separating information within the healthcare data sets. ICD, that's one that many of us are probably familiar with. We've heard of ICD-9. Now we're at ICD-10. Within the two or 3 years, ICD-10 came into fruition. So what that does is reclassify or improve the classification or description of many of the classification of diseases as far as billing is concerned. CPT, current procedural technology, LOINC and SNOMED, again, that's nomenclature, identifier names and codes, and the systemized nomenclature of medical reference, and then clinical care classification and international classification of primary care. What this does is ensure that the terminology and vocabulary that is being used, even between these different systems, is standard. standard, because there may be 5 different names for the same thing. That's not necessary. We need to ensure processes are more efficient and streamline those processes, okay? Other data coding standards, data exchange standards, and the data schema standards. Um, Data exchange standards uses a standardized interconnecting system to transmit electronic data, standardizing the order and the sequence of data during transmission between 2 points across a network or submission. So it's the sharing of data, sharing of messages, sharing of information between 2 points across a network or a sub-network, a network within a network. Okay. Then you have the schema standards that involve defining essential data elements in the database and specifying the structure, the domains, the rules, and the relationships among these data elements to be maintained within the records to facilitate data retrieval. Okay, so this is the structure, this is the content. How is it established? How is it housed? Right? These are essential data elements within the database. Okay. Health level 7. You may see this as health level 7, health language 7. In any case, this is a system development organization, and they implement health language 7. Their aim is to promote interoperability for the interchange of healthcare data. Now, we talked a little bit about this in topic 1 as well as topic 2. When we kind of scratch the surface of the purpose of standards in healthcare and information exchange. The level 7 piece refers to the highest level of the International Organization for Standardization. Okay. The chief aim of HL7 is to address the vocabulary problem, which has really been a barrier in many of the healthcare management information systems as far as the development and implementation, as well as for those who are utilizing these computer-based applications in practice. Okay. HL7 is currently used in about 2,000 leading hospitals in many countries. So that definitely speaks to the credibility of HL7 as a service and as a process to be adopted. In the United States alone, however, HL7 standards have been very influential, where we have more than 150 major healthcare and regulatory, like the CDC, institutions utilizing and that have adopted the HL7 standards. DICOM, this will be on the pre-assessment, so it means maybe it could translate to the objective assessment. So make sure you understand DICOM, digital imaging and communication in medicine. This has certainly emerged to fulfill the need for transferring digital images of various formats as well as related information between devices. So DICOM is a system that allows for the transfer of information, but the information is digital images. Okay. So that would be, your x-rays of all types, your MRIs. It's transferring the digital images, okay? 5 general applications covered by the DICOM standards: network image management, network image interpretation management, network print management, imaging procedure management, and offline storage media management. The DICOM standards are used or will soon be used by clinicians. Well, they're used by clinicians in all different practices, okay, of medicine. Web standards. Generally 2 categories here: table-free sites and a site using valid code. What we want to make sure we know about the web standards, they're typically comprised of HTMLs, XMLs, XHTMLs, and modularization. Just know that web standards are used as far as assisting with the establishment of exchanging information. Governance, policy, and international perspectives in HMIS. Here we just want to make sure that we are able to identify similarities and differences in the mobile means of care, telecare, or e-health rather. Remember we said e-health was all encompassing. To determine the applications of e-health, understanding the economic perspectives of e-health, identifying factors that influence the adoption of e-health among healthcare organizations. What are some of the barriers to e-health adoption? The importance of stakeholder analysis and identifying the major stakeholders in globalized e-health. And lastly, the relevance of the WHO, World Health Organization, strategic framework for e-health development. Make sure you know each of these definitions: telecare, telemedicine, telehealth, and e-health. These slides are available in the course resources. Therefore, you will be able to view each of these definitions and commit them to memory. We've seen this visual before, right, in topic 2. And this is where we get e-health being all-encompassing: telecare, telemedicine, telehealth, and e-health. Once you understand the definition of each of these 4, you should be able to place them in this visual more easily. Who are our stakeholders? International organizations, governments, physicians, clinical providers, hospitals, patients, application vendors, and third-party vendors. Ultimately, the takeaway is standards are important. They are essential. They are helping establish the framework, or they have helped to establish the framework to ensure the safe transmission of data. Thank you so much for viewing our topic 4 discussion. If there are any questions or concerns, please do not hesitate to reach out to your course instructor. Otherwise, have a wonderful day.